Hi there, this is Dr. Raj Kakar. I'm welcoming you to Dallas Sleep, and this is our weekly uh, minute on sleep health. Today I wanted to talk about the difference between obstructive sleep apnea and central sleep apnea. That's a common question I get from a lot of our patients here at Dallas Sleep, and so I thought I'd spend just a minute or two talking a little bit about that today. Um, so obstructive sleep apnea is a more common type of sleep apnea. It's something that we see very often on a regular basis, and obstructive sleep apnea is a problem that occurs while you're sleeping, which is due to the airway here in the back of the throat closing off at various times throughout the night, repetitively, which contributes to snoring. It contributes to frequent awakenings, disturbance of sleep. It can also cause people to wake up feeling less rested and refreshed and feel more tired and sleepy during the daytime. So what obstructive sleep apnea does is it's causing this collapse of your airway, which is limiting the amount of airflow that can get through, and that's what's kind of causing all of this disruption of your sleep quality, as well as you're affecting then you're having daytime symptoms with daytime energy problems. The other thing that happens with obstructive sleep apnea is because you're not getting that air through at times, the oxygen levels in our body can start to drop because you're just not getting enough air to your lungs to maintain your oxygen levels. So these low drops in oxygen levels throughout the night actually put more stress on the body and can contribute to high blood pressure, can put more stress on the heart, causing arrhythmias like atrial fibrillation and other types. It can also even lead to increased risk for heart attack or stroke, and that has been very well documented throughout the years. So there's definitely some serious consequences to having obstructive sleep apnea. Again, it's a more common type of sleep apnea. What causes it? It's due to the size and shape of the jaw and upper airway. This anatomy of our jaw and upper airway, which is something we inherit from our parents, that's what determines if you're more likely to get obstructive sleep apnea. It generally tends to get gradually worse with age and with weight gain. So age is the number one risk factor, which nobody's found a cure for that yet. And weight gain is another risk factor, which can make it worse. Now, these aren't the causes for obstructive sleep apnea. They can be exacerbating factors. But the underlying cause is the anatomy, and that's hereditary. So going back to central sleep apnea, or central apnea for short, the difference between that and obstructive sleep apnea is in central apnea, your airway may be open or closed, but you're not even making an effort to breathe. With obstructive sleep apnea, you're struggling. You're trying to get some air in, so you're making that effort. With central apnea, you're not making any effort. It's like the brain didn't send the signal to breathe. It forgot to send the signal to breathe. So the airway may be open or closed, but they're not really making that effort. And so that can happen once in a while. So that's really the difference between the two, and in some cases we see both, a kind of combination of both. So, and when we see both together, fairly close to equally or in high numbers of both, we refer to that as complex sleep apnea. So there are different causes and reasons for these, and we'll talk more about it in future videos. Or if you're interested in learning more, come and visit us at Dallas Sleep, and we'd love to help you. That's dallassleep.com. Thank you.